Hey guys, so today I'm going to be making a video all about the Jackson Pratt Drains, also known for short they call them the JP drains, and they are these little guys right here. They don't make the best accessory, but you know, my surgery was exactly a week from today. I had my double mastectomy last Wednesday, and today is Wednesday, so it's been a full week. It went really, really good. The first few days, they gave me a 3-day, like a anesthetic. They put it in during surgery. It was like an extended pain medicine that lasted for 3 days, so I was very numb. So the first few days wasn't that bad, actually. And then around Sunday, it started to wear off, and I started to have more feeling. The numbness wore off, so it did start. It wasn't like it was bad pain. I had definitely had my moments, but it was more of a like uncomfortable feeling. But overall I'm doing good, and I wanted to make this video because these drains, I mean, they seem really scary, and so I learned kind of, a lot about them in the last year, and just a little, some tips and tricks to kind of, if you want to go out, what you can do to make it more comfortable and less noticeable, and just how to, milk the drains and keep them clean, and just some information about them. I'm going to show you mine and how I, milk the drain and empty it. How did I track down the cc's, and yeah, I'm just going to show you guys some information, so if you're interested, then keep watching. After surgery, you will have a drain or drains called a Jackson Pratt drain, also known as JP drain. This device suctions and collects fluid from your surgical area. The drain promotes healing and recovery and reduces the chance of infection. The drain will be in place until the drainage slows enough for your body to reabsorb fluid on its own. While you are hospitalized, the nursing staff will care for the drain and teach you how to continue to do so at home. Just to show you, I don't want to show, too much just because it is, the internet, but I will show you kind of just what it looks like, because I know that, you're probably thinking, well, where are the drains, where do they go into the body, where is it coming out of? So, so just to give you some info just so you know what to expect. So they each drain, so I have one on each side. So that's one side. And then on my other side, here's that one. So they put this little spongy thing right here, which I think makes it more comfortable. And they also, they put a clear thing, so it just keeps it safe from dirt and germs, and if you get it a little wet or anything. So yeah, so you can keep your drains inside your shirt like this, but I don't know, I feel like an alien's inside me or something. I just feel like it's a little weird. So when I'm like around the house and whatnot, I don't, my family is, totally supportive, obviously. So I just have them out like this, and they're going to give you this little cotton necklace. I'm not sure if every doctor's office does this. I know, me and my mom went to the same doctor, so my mom's doctor did it, and they did it for me as well. But it's like this little soft piece of, Tilly, it's my dog. It's this soft piece of cotton, and they tied it in a knot, and then it just secures the drains, because the drains have these little flaps on them, and then it kind of just hangs nicely. So I definitely recommend, if they don't do that, I definitely recommend, making one yourself, or asking them if you can get the material to do it, tie a knot, and make a little necklace for them. When you're in the hospital, you can ask the nursing staff, can you give me some supplies, some alcohol, slabs, maybe some gloves. And so you can wear a glove if you want to, or if you don't feel comfortable, just make sure your hands are washed thoroughly. And then you're going to want to have some alcohol pads. The nurse gave me a whole bunch of these, and just like a whole bunch of gloves. And then they're going to give you these 2 clear containers. And I'm going to hold this and I'm going to give it some slack because you don't want to pull it and then pull the drain. So hold this as like an anchor and give it some slack, and then just keep it there, and then only move this hand and then take your 2 fingers and pull it down. And then you're not going to want to let go of this. You're going to want to keep holding it. So then what you're going to want to do is let go of that, the anchor, and make a new anchor right by your other 2 fingers. And you're going to want to hold it tight again, and then you just move again. So again, this hand is using as anchor, so you don't have to pull. You're not pulling. You can get a nice grip, and then you're going to do it again, and then just keep pulling. So you really don't move. I mean, there's a whole bunch of different ways. You can do whatever way is comfortable and works for you, but this is how I do it. And you want to keep going, and I'll show you from up here. So yeah, so I just take it, and I go, whoo, and then I take it again, I go like this, like this. And at first, your blood is probably gonna be really dark, and then after a few days goes by, it will start to lighten up a little bit. And it's kind of gross, but towards, you know, I would say the 4th or maybe like between the 3rd and 5th day, you start to get little like clots, me and my mom call them, but they're just kind of, I mean, yeah, they're like little clots that get in the tubes, and that's actually why you want to milk them, because you don't want it to clog up. Sorry, my dog's making noises. You don't want them to clog up and make it so it won't, you know, go in the tube. So we just did number 2, so I'm going to take number 2, I'm going to open it up. And I can't drain right now because I'm hopefully getting my drain out tomorrow, so it's going to be, so we need to see, I have to be under 30 cc's for a 24-hour period. So we drained this morning at 11, so we're going to drain tomorrow at 11, and if I'm below 30 cc's, I get my drains out, so I'm really excited. So I can't drain them, but I'll just give you like an example. So you are going to take, you're going to open the little flap, and then you're going to take it and you're just going to drain out all that, the blood, basically. And then you're going to be left with blood in here. You just set that aside. And what you're going to want to do is you can take a alcohol tab. Again, you can ask the nurse to just, you know, throw a whole bunch in your bag. Take it and just, you want this area to stay as clean as possible. So just clean all around there, the cap. And then you're going to section. So really important part, you're going to want to suction. You're not going to want to just close this because it will open and it won't suction out the fluid. So what you're going to want to do is you can either do it like this, you can just grab it and section it like this. Again, this is going to be empty. And close it so it leaves a nice section, or you can go like this and close, whatever's, you just want to section. So that is how you milk the drains. And then again, so you can throw, there's gonna be blood. So you just so you're gonna see there is 20, 40, 60, 80, and 100, and it goes by milliliters, like cc's. So what you're gonna want to do is say, you know, I just drained this and it was at 40. So you say, you know, oh, it's at 40. Okay. So you take your, so they should give you some kind of sheet inside of the hospital. My sheet. Just to give you a kind of idea where I was. And what I recommend, what I think is really important, because you just want to make things as easy as possible. I think you should just take your sheet. This is, you know, where I recovered my bed. So just stick your sheet on a wall so it's out of the way. You know where it is. If someone's helping you, they know where it is. It's in one place. It's out of the way. It's just there. So what you're gonna do is you're gonna take it. You're gonna be like, oh, I'm at 40 cc's. This is number 2. So then you would go over to the wall. You would put the date, and then you would put the time that you did it, and then it's either gonna be drain A or B or 1 or 2. Mine was 2, so I would put 40. And that's it. So definitely ask, you know, your nurse or your doctor how often you should change it at first. Mine said, you know, whenever they get really full, you know, at least once in a 24-hour period, or if they get really full, you know, do it maybe twice in a 24-hour period. Try to do it around the same time. I don't think it matters at first, but after, you know, around the 5th or 6th day is when it starts slowing down. And once, you know, I don't know if every doctor is different, but my doctor, once they're under 30 cc's for a 24-hour period, then I get my drains out. So you really want to get them around the same time. I'm going to show you how to kind of make it a little bit more comfortable when you're about to go out during the day. I recommend, the shirt I'm going to wear is a purple shirt because it's just all I have right now. But I recommend wearing a black shirt. It just camouflages more. But you're just going to need a necklace that doesn't, you don't want it to be a choker or anything. You want it to come down to about here. So with this little necklace thing that the doctors give you, they kind of just hang down. But you can do, you know, any necklace that's, you know, that's loose and that has, you know, big circles in it. Kind of just take it, put it on. Okay, and then this goes up to, you know, about right here. And then these little drains have little tabs on them. So what I'm going to do is you're just going to need 2 safety pins, which I lost. Oh, here it is. So you're going to take one of the safety pins. Okay, and you're going to, so I'll come closer. So you're going to go put it, just, and be really careful. You don't want to accidentally poke a hole or anything in these. So what you're going to do is you're going to go through the little tab, and then you're going to bring it up to the necklace and safety pin it. So it's like, so it's up here. And then you're going to do the same thing with the other one. Take the drain. You're going to stick the safety pin carefully, you know, through the strap, the little tab. And you're going to bring it up to the circle necklace and tab it. So this way, tuck these in there. So this way, they are up higher besides down by your stomach. They're just a little easier to camouflage. So what now I'm going to do, let me put on a regular shirt. Alrighty, so the necklace with, and I did that, connected them there, so the little tubes are up here, and then I kind of just flatten them out right there. And then you can take like a scarf, and just, I live in California, so it's hot right now, so I'm just going to take a light one and just kind of bring it around. This doesn't match, but kind of just bring it around. I recommend wearing black. I think that black camouflages more, but see, you just go like that and it kind of just hides the drains, and you have a little bit of bulge right here, but it kind of just looks like boobs. You know, it's better to have the bulge up here so it looks more, you know, like boobs, than down here and it looks, you know, like, oh, why does she have a bulge in her stomach, you know, what's sticking out of it. So I think it's easier to camouflage, especially with a little scarf or something. You can get it bigger, thicker. So yeah, just like that. So that's just one trick to kind of make it easier. I wanted to make this video because these drains, I mean, they seem really scary, and so I learned kind of, you know, a lot about them in the last year, and just a little, you know, some tips and tricks to kind of, you know, if you want to go out, you know, what you can do to make it more comfortable and less noticeable, and just how to, you know, full week. It went really, really good. The first few days, they gave me a 3-day, like a anesthetic. They put it in during surgery. It was like an extended pain medicine that lasted for 3 days, so I was very numb. So the first few days wasn't that bad, actually. For short, they call them the JP drains, and they are these little guys right here. They don't make the best accessory, but you know. My surgery was exactly a week from today. I had my double mastectomy last Wednesday. Today is Wednesday, so it's been Hey guys, so today I'm going to be making a video all about the Jackson Pratt Drains, also known, and then around Sunday it started to wear off and I started to have more feeling, the numbness wore off. So it did start, it wasn't like it was bad pain, I had definitely had my moments, but it was more of a like uncomfortable feeling. But overall I'm doing good. And